So thank you. Thank you, everyone, for joining us here today for the Incarceration Prevention and Reduction Task Force and Law and Justice Council meeting for June 24th, 2024. And we'll begin with our land acknowledgement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, Semiahmoo people, who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us here together today. And please join us in uncovering such truths at any and all public events. We do have a group of folks from Spokane that may or may not be attending this meeting today, but they are here for the next few days to meet with a variety of folks about our justice project and moving something like it forward in their community. And one of their members I met last night from the Colville tribe, and if she was here, I'd like to acknowledge her work in her community. All right. Well, we have two members today. I hope they're here who have been on the IPRTF for some period of time. And this will be their last meeting. Bruce and Darlene, are you here? I see Darlene. There's Darlene. Is there any wisdom that you would like to drop on us in your last meeting, Darlene?
Well, I don't know if I have any wisdom, but I do want to say it's been a pleasure to serve. And I am very excited for where this group has brought us and where you're going. And on this meeting, you'll see the name of Tammy Bennett. Tammy Bennett is my chief deputy, and she's going to be taking over as the court director for the city of Bellingham. So thank you very much for the privilege of serving. And I continue to be excited about your good work.
Well, thank you so much. We really appreciate the community. I'm speaking for the community here. We appreciate all of your the time and energy you've spent on these matters. So thank you. And Bruce, are you on the call today? Not seeing him.
Bruce is out of the area until tomorrow.
Okay. All right. Well, thanks also to Bruce for all of his good work. So on our agenda today, our first item is the annual report, the 2024 annual report, and we're going to review and vote. I have a few proposed changes. I'm not sure if anyone else does. And Jill, do you want to lead this process? How would you like to see this go for greatest efficiency?
Yeah, sure. First of all, I want to correct my statement earlier. It looks like we are 2 individuals short of a quorum, so we won't be voting on anything at this time. I will just say that the annual report is in your packet, and if you have any feedback or suggested changes, I'd love to hear them today. We can talk about that, and then any substantive changes will need to be done by motion. And then when it's time to vote for those, I will be asking everyone to share their screens and do a thumbs up or based on your vote, yes, no, or abstain. That's really all I have, unless you would like me to go through everything page by page.
No, I think that is, that's okay.
I agree. Thank you.
Scott, I see your hand up.
Yep, I have, now you're getting the picky me coming out. So let me get the thing up here a second. On page 4 of the packet, which I think is page 2 of the report. The last 3 names in the task force members, their titles are the same font and all the others are a smaller font. See, we're getting real picky now. So I want that to be consistent.
Mhm.
And then the Crisis Stabilization Facility Committee. It just bothers me that that the column on the right is longer than the column on the left when the others are the other way. So you got to move Mike Healy to the first row. And my preference is on the Information Needs and Data Exchange Committee. That should be 2 columns like the other ones. But other than that, the report's good.
Thank you, Scott. I
Great.
sent, I
Thank you
sent
for
Jill
responding.
a few small things like that this weekend, but I do have a few more substantial changes. Jill, are you suggesting that I propose those now, and then if we are able to vote on that today, we do so, or how would you like my changes?
Yeah, I think you're welcome, of course, to talk about what those are now. Until we get a quorum, we cannot vote on those.
Okay.
I'll let you know as soon as I get a quorum count, when we can do that. So maybe we can come back to this at the end of the meeting.
Okay.
And if we don't get a quorum enough to vote today, then it will be put off to the July meeting.
Okay, very good. If we put it off to the July meeting, is that going to push everything out? Will that cause any issues with reporting to the council?
The report is due the end of June, so if we miss it by a few weeks, I'll let Barry correct me, but I don't think it's going to be, I don't think it's going to cause any issues specifically.
Okay.
No, we're good. The council's fine with that, I'm sure.
Okay. Okay. Thank you, Barry. And thank you, Jill. So we're going to move on to the next item. And looking here, we have, oh yes, a presentation from Mayor Lund and Chief Mertzig and Chief Hewitt. So Kim, would you like to take it away?
Sure. And it might be easiest if I can share my screen and just pull up the executive order. Does that sound like a good idea, Peter?
Oh, yeah, that sounds great. Jill, does she have permissions to do that?
Yes, all presenters have share screen permission.
Oh, very good.
Okay. Let's see. Oops. I'm sharing my screen, but now the controls are in front of the tab I want to open. All right. How about that? Do people see what looks like a set of actions now,
Yes.
therefore?
Yes, we do.
Is it big enough for folks, or can I make that a little bit bigger?
I can read it just fine.
Okay.
Yeah, it looks good.
Okay.
Okay.
Well, good morning, everyone. I appreciate the invitation for myself and the chiefs to be here. I think we're just over 4 months in now to the executive order to put some stabilization measures into the downtown core. In February, we called for 11 immediate actions within our budget authority to respond to some of the overdose response calls and deaths that were occurring in the downtown commercial core here in Bellingham. So I thought, as a matter of process, to report out on where we're at 4 months later, we could just step through these 11 actions. And the first one called for establishing a downtown public safety response office. And that space is up and running. The community paramedic team and Grace have relocated there. And I can let the chief, Bill Hewitt, talk more about that if he wants to. But it's been I think there's qualitative feedback from the surrounding businesses and members of downtown that it's appreciated to have that emergency response vehicle and presence in part of our commercial core. And we're seeing, while it looked like overdose calls were trending down a bit, it's important to acknowledge that May was one of the worst months that we've had in Whatcom County and the downtown for both overdose calls and deaths. So May certainly didn't trend in the right direction. But we are having slightly faster increased response call times and slightly increased acceptance for transportation, and both of those are part of our goals in response to an overdose call. And Bill, would you like to speak any more about that point?
Yeah, just real briefly, looking at the first 6 months of this year versus the last 6 months of last year, we are down just slightly from 1.19 overdoses per day down to 1 a day, so that we're trending in the correct direction. Also, we're seeing 66% of our clients that are willing to accept transport, as opposed to the end of last year where only about 55% were willing to accept transport. So we're definitely seeing a difference there, getting more people to, and the transport number, the purpose that we're tracking that is, that's more people who are getting hopefully a greater level of care or more definitive care, because they're making it up to the ER and actually seeing doctors and hopefully getting referrals. So yeah, while yes, May was a bad month overall, when we look at this 6 months this year versus the last 6 months from the end of 23, we are moving in the right direction. The other thing, just anecdotally, is the downtown office. Both our community paramedics and our Grace folks that are assigned, because that's where a majority of their clients are. They're just finding much more productive use of their time, being closer by, being more in touch with the other agencies that they interact with down there. And so it's worked out quite well for us.
So that kind of covers the first 2 actions. Number C, the third action, was exploring how the city can support expanded access to methadone and other opioid treatments in our high overdose areas in coordination with other agencies. And I'm not sure if Dan is on the call right now, but Council President Hamill, he's been instrumental in leading this as the city's representative in conversations with the Swinomish tribe about 2 mobile medical units that could potentially service up to 400 individuals. Those conversations are ongoing and advancing. And so he's been leading on behalf of the city to support that work. We expect that could be coming online towards the end of the summer or this fall. We are also continuing to meet and check up on this work. So I get together with Public Works, Fire and Police, just to touch base and make sure that this is a cross-departmental effort and everyone's working towards that end collaboratively and with a one city approach. So we're meeting and having these conversations regularly to touch in. We talked about action E. The 5th action is immediately prioritizing the enforcement of laws prohibiting the sale and distribution of illegal drugs, and seeking a partnership between BPD and the Whatcom County Drug and Gang Task Force. And I'll invite Chief Mertzig to talk about where that's at.
Unmute myself first. Thank you. I think E, F, and G are actually probably all kind of enforcement interdiction related. So I'll just kind of share broadly. Earlier this month, I had the opportunity to be in a law enforcement forum where the DEA presented. And since the executive order to now, Chief Tinksley and I have been working really hard with our teams to get an interlocal agreement going, and having the Bellingham Police Department rejoin the task force. We've been a part of it in the past, and so our staffing numbers didn't allow us to continue that participation, and now we're doing much much better. Our recruiting teams have been having a lot of success. So that kind of covers G, which allows us to do F. So that is getting really close. Hopefully, I would say this summer or before the end of the summer, we should be up and running with the task force if all goes well. I just kind of wanted to share some of what the DEA presented to us. Some of it was news to me, in fact. So fentanyl is now the leading cause of death for Americans between the ages of 18 and 45. And we're seeing the average dose of fentanyl increase. So when you see these months where you see these spike in overdoses, Bill and I are always watching the numbers and we're like, are you seeing an increase? Yeah, I'm seeing an increase. And typically that's because a batch has come into town that may be potentially higher than others. And you might be asking yourself, at the end of the day, it's kind of seems callous, but this is a business. It's based on principles of supply and demand. And we're seeing these dosages increase. In 2023, 7 out of 10 pills tested contained a potentially deadly dose of fentanyl. This is an increase from 4 out of 10 in 2021 and 6 out of 10 in 2022. In which you're asking, why would you want to have your customer base die? And the reason for that is the customers, their tolerance is increasing. So their dosage therefore has to increase. So we're seeing this horrible increase in dose. And if you're a first-time user or trying it for the first time, or you think you're getting, your buddy is selling an Adderall or a Xanax, you think that's what you're getting, you're not. You're getting a potentially lethal dose of fentanyl, again, to increase the amount of users. But that's why the DEA is very strong on the 1 pill can kill campaign, because just 2 milligrams is a potentially fatal dose. In 2023, the DEA removed 4.8 million lethal doses from Washington State, and that's the third highest in the country. And you might be asking yourself why. We are strategically positioned along the I-5 corridor. So that is one of the major reasons why we are pushing hard to increase our staffing in the task force.
Great. Thanks, Chief. I think one point that I wanted to emphasize, that as we do have more of an increased presence downtown with police, we did see in those first few months after the executive order took effect, increased arrests for both drug dealing and use and other drug-related crimes. But I want to emphasize that despite all of the additional hours and, officers walking in the downtown area, we did not see any significant increase in citations for sitting or lying or just being in the downtown. So really the emphasis is on those highly impactful behaviors. And that is continues to be BPD's emphasis while they're down there. So I think that's a relevant point to emphasize with this group here. Item G, we talked about a bit. We're still full steam trying to recruit and bring numbers back up in the ranks. And we're having some, we're seeking to fill our budget, our general fund deficit across the city. We're targeting some strategic holds on vacant positions, but that is not true for the first responders. So our public safety departments are exempt from those budget directions. So they're continuing to hire and fill our gaps. Public Works has spent some additional time downtown, especially in the first few months, but that seems to have leveled off. They're back closer to 2023, and it's still looking pretty clean. So I think they have a good plan in place. And I also want to emphasize we are about a month out from getting the 2 Portland loos online downtown. So we are very close to having 2 additional public restrooms in the heart of the commercial core. We have the one at Waypoint Park up and running now. And it's just been a matter of hiring to fill those FTEs. For those 3 bathrooms, it was 2.5 FTEs that we had to recruit for. So we have recruited for those positions and are bringing them up online now. And as mayor, it's item number I, where really I've been spending most of my time since issuing this order. So we meet several times a month. Sometimes there's up to 30 key members across all departments, including the library, the museum. We're working on this comprehensive downtown strategies plan. So that group has been branded as Downtown Forward. The tagline is "It starts in the heart." And this is where there's exciting work happening at the city for both continued stabilization between now and the end of the year. And then what are the policy changes? What are our strategic plans for building community vibrancy? We were able to secure and combine general funds to create, we'll do a 3-year rolling RFP for activation and community building in the downtown core for the total of $850,000, which is extraordinary and very exciting. We've been able to review, we had 47 submissions to the first round of community building. And I think our approach with that is, Heather said this before, you know, really right now, one of the antidotes for these, the crisis that we're in is community. And that is the intention of this RFP, is to strengthen community in our downtown core. So it's very exciting to see what some of our creatives and artists have put forth for building that community. And we're looking forward to building on that. So that's a huge part of my work and time and emphasis as mayor right now is on that line item number I. We're continuing to work with our partners about education for substance use disorder. You know, we're working where we can. The Bellingham Public Library will be doing bringing a speaker in to talk about these impacts. Continue to support fiscally work like the All Hands Summit taking place this week. And we continue to be in conversation with electeds at the state and the federal level to support resources for these efforts. So all of that is ongoing, and that's kind of the update that I have right now. I would say that outside of this executive order, what feels to me is such important work, if we think about the Justice Project implementation plan strategies and how the city can be working towards that end, is we have finalized within Human Resources the job description for our strategic initiatives manager at the city that's going to have a behavioral health and human services emphasis. And so that person will be dedicated to being a liaison with groups like this, the MAC group, Whatcom County Health Department, all of our community providers that are doing this work. So, and helping to strategize as more resources become available through the Justice Project sales tax, where we're strategically directing those assets to support the implementation plan goals and strategies. So we have not had a dedicated resource at the city yet to oversee and be the steward of that work. So I'm tremendously excited. We could be posting that as soon as this Friday. I'll make sure to share out with this group when that job posting goes live. And I would appreciate this group's efforts to help us do a successful recruitment. And another key piece is just housing and childcare. And we closed on a real estate transaction on Friday, and a press release should be coming out later today or tomorrow about another significant project that will add more than 100 units of permanent affordable housing and about 100 spaces of childcare in the community. So we have another project we're excited to announce and roll out. And really, that is the important work that the city can be playing. So I just wanted to share those updates outside of the executive order, but directly connected to this task force work. So that's my update, and I'm happy to take questions.
Very good. Thank you so much. What questions do we have for Mayor Lund and Chief Hewitt? And let's see. I am looking for raised hands. Oh, there we go. Heather.
Well, thank you, Mayor Lund, and everyone for all of this incredible work and the presentation. It's really nice to be walked through the executive order. I was wondering, I just have a few questions that might be interesting information and helpful information for the task force. In the second whereases in the executive order, there it says that 788 calls placed to 911 were for suspected overdoses countywide in 2023. I'm curious if we know about how many calls in total go to 911. Do you know that, or can we find that out?
Just to clarify your question. So 788 calls were placed to 911 for suspected overdose countywide. Are you asking if all calls go to Whatcom or if they go to a different dispatch?
No, I'm asking out of how many. What's the denominator of that?
That would be something Allison I could find out and get back to you on.
Actually, I might be able to check my inbox real quick.
Okay, I'm just curious. It's just
Allison. Yeah.
Yeah. And I wanted to just acknowledge the, let's see, third, fourth, fifth, sixth, seventh, whereas I really appreciate the acknowledgement of the affordable housing and the childcare and just the interrelatedness of all of these issues. And really appreciate the city's work to advance on all of those fronts at the same time. And then on the therefores for letter B and C, I'm extra curious, especially for our behavioral health subcommittee. And as we start to implement the justice project, that letter B, especially the expanding outreach and treatment options. I would love to know what your team is learning in that expansion and what's helping people say, yes, I want to go to treatment. Where are there still barriers, and is there any measurement going on for how many people are accepting that outreach? I'm really excited about that addition to your team and that approach. So
Yeah, if I can jump in just on the, I think one of the reasons we're seeing a higher level of transport here is because we do have, as we retest our community paramedic and Grace partnership with working on this, we have a greater time to interact, and where our crews are normally our operations crews are normally on scene, try to solve the problem, and then move on to the next emergency. Those crews are able to interact more, build relationships more, and that's been helpful. One of our biggest barriers is just the lack of places to take people. Right now, the ER is the only, pretty much the only option for our first responders. And it's a gateway to other options, but right now that's the only option for where our first responders take people, drop them off. And so I think as we are looking forward to all the stuff that Council President Hamill's been working on with the Swinomish tribe and all the other things that are coming together here. As we see more options come along, I'm hoping those numbers continue to increase.
I would say one other piece that might be tangential to that is as we, as a community, have done more training about Narcan delivery and protocols for citizens delivering Narcan on the streets. I think that is more supportive as well until first responders and people, as they know more, they're not feeling a rush to push out like 3 doses of Narcan quickly kind of thing before there's a first responder on the scene. So I think as that is supportive as well, because they're following protocol that's closer to if a first responder was the first on the scene. So I think that's somewhat helpful as well, that education piece.
Very good. Maya, do you have a question?
Sorry, good morning. So I understand there'll be some increased, I don't know, employees maybe given to the Bellingham Police Department Drug Task Force or increased presence. Was I understanding that correctly?
It's, we've previously been part of the Whatcom County Drug Task Force and we are rejoining it. So we're gonna have 2, a sergeant and an officer potentially joining.
I guess my question on that front would be like, what diversion programs will the city be implementing to try to avoid just shoveling more people into the criminal legal system, and what services will be provided to support those diversion programs? Thanks.
These, the task force is gonna be primarily focused on mid to high level dealers, not the end user. So, you know, those are gonna be entering into Superior Court, those are gonna be felonies. And so it's gonna be whatever the county has to offer in terms of after they're arrested. It just really depends on the type and size of case. There's gonna be occasion and time when they're gonna be working federal cases as well. So it's really not, the task force itself is not in any way, shape, or form geared towards, you know, arresting folks that suffer from substance use disorder. It's more about the folks dealing.
I'll just say that in my experience, the task force uses a lot of CIs. Is that accurate? Confidential informants, which are user level folks that they leverage to get information on dealers. So it does, I mean, that's been my experience historically about how the task force kind of does a lot of its work.
Sure.
Sheriff, do you want to jump in and speak to that point?
I do want to jump in. So I will say this isn't new as far as having Bellingham join the task force, but what is new is that I think if we look around the entire county to see how how fentanyl has affected many families and in fact different opioids as well, that this is a county-wide issue. So right now our task force, we do operate a lot in the city of Bellingham. So this would give us that extra capacity to not only continue working in Bellingham, but also other parts of the county. In terms of the confidential sources, in any type of sensitive investigations like this, sometimes there are sources that we use. However, I will second what Chief Mertzik said with regard to we are not going after low-level users doing these operations.
All right, Mike Hilly.
Yeah, thanks. I just wanted to respond to Heather's question about the data. And so, and these are EMS dispatch calls for suspected overdoses year over year. I can go all the way back to 19, but I won't. 2022 had 463, 2023, 662, and here we are in June of 24, already at 725. And in the county, we are averaging 4.5 overdoses per day out there with some spikes as well. So I do wonder why it's being reduced in town. Are we seeing some of these overdoses being pushed out, or is it just more of a collection, or these clusters that happen out in the county? But we're seeing it going up in the county as a whole.
Do we have any other questions for Mayor London, the chiefs?
And I would like to add in there too, when Heather, when you asked about the kind of percentage of calls, I don't have the overall percentage of 911 calls, but in Bellingham Fire Service area, I can tell you the overdoses represent about 4.8% of our EMS calls for our service area. So I don't know what they are in the bigger picture, but as far as EMS calls, it's almost 5%.
It trends the same in the county, Chief, about the same percentage, yes.
One other piece I'll just add is that in Bellingham, the sales tax revenue, the 25% that won't be going to support the capital construction buy down. So 75% of what we are receiving in these first few years will go to those capital construction costs. The 25% will stay to support the Justice Project implementation plan goals and strategies. And what early on that will enable continued support for some of our diversion programs that we had heavily leaned on ARPA funds and COVID relief funds to make those investments, and would otherwise be in jeopardy of continued support. So we will be directing a portion of our funds to continue those diversion programs, and we're looking forward to what can come next after that. So
very good. Well, thank you so much for your presentation. We very much appreciate your being here today. And for the next item, I'm going to hand it over to my co-chair, Heather Flaherty.
Thank you, Peter. It's a perfect pairing today, and it's my pleasure to welcome Kayla Schott-Bressler and Erica Lautenbach to share more about the identifying Whatcom County approaches to the fentanyl emergency and MAC group recommendations. So welcome to the task force. Thanks for being here.
Thanks for having us, Heather. I'm going to get us started off, and I'm going to share my screen as well. So let me do that. Can everyone see that okay?
Yes, we can.
Let me just get it in slideshow mode. There we go. As you all know, our county council back in April passed a sort of a declaration making fentanyl an emergency, but not an emergency declaration. And then the executive, who I see is here today as well, followed up the next day with a executive order and requested that by the end of May, my department, Health and Community Services, respond with a plan. And I'm going to go through that, but I want to just start. Actually, I'm going to talk a little bit about, so here's our purpose for our health department, which is why we've been tasked to do a lot of the sort of leading and convening around fentanyl. We have 5 Ps for our purpose statement: promote, preserve, prepare, provide, and prevent. And fentanyl and overdose prevention falls into 4 of the 5. And actually, I think I could make a very easy argument that through our Whatcom overdose prevention website, we're also providing accurate and reliable health communication and information on a monthly basis. So just a little bit of grounding. I want to talk a little bit about Strategy Zero. And when I talk about Strategy Zero, this will not be a surprise to any of you. So I'm gonna go through it pretty quickly. But when we in public health think about communicable disease spread, we are always looking for the source, and that we either call the index case or patient zero, trying to identify the source, and then from there being able to understand how that disease was spread, or the source of the disease, like the egg salad at a restaurant, and how that then moved on. And so when I think about sort of macro level problems like this really broad and far-reaching issue of fentanyl and overdose, I think about, rather than a patient zero, sort of a strategy zero. And so when we think about strategy zero, it's really that primary prevention. And we've talked about this, you've looked at this in a lot of your plans, but it's worth coming back to, especially as it relates to overdoses and drug use. And this data is from Washington State prior to fentanyl being sort of the dominant and smoking being the dominant method of delivery for drugs. But you can see that when we talk about early intervention, when we talk about support for the little ones, kids who have no ACEs have about a 1 in 500 likelihood of using IV drugs when they're adults. Whereas kids with high number of ACEs, it goes down to 1 in 30. It's really dramatic. And I think that we can't talk about criminal justice issues. 77% of women in state and federal penitentiaries have ACEs. Over 50% of men have ACEs. Like, we can't talk about any of these big, complex societal concerns without talking about ACEs, because this is the strategy zero. If there's a silver bullet, so we stop chasing everything over and over, the next thing, the increase in homelessness, the challenges with our criminal justice system, drug use, mental health concerns, all these things, we're just going to keep chasing them until we get to strategy zero, which is really focusing on primary prevention. And that's a big part of my department's role in all of this. But I think it's worth noting because it was actually mentioned by a lot of our healthcare providers and our MAC group members. Why aren't there more primary prevention strategies in the ops plan? And so I do want to say that those are connected and important and complementary efforts, but they're happening sort of in different buckets within our department. So as it relates to the fentanyl ops plan, there are, we used the PETA model, so prevention, intervention, treatment, and aftercare recovery. In prevention, there are 8 strategies that we're working on. And I will say that some of this work is happening already, which is really exciting. We will have, and we've already pushed out some education materials for the general population, and we'll be doing more of that in the coming weeks. We, if you can see the targeted training to medical providers, this sort of goes along with our intervention strategies. But last week, we, with the Northwest Medical College and or Northwest Medical Society and Peace Health, sponsored a training for PAs, MDs, and ARNPs, and over 150 people came to learn more about how to prescribe MOUD, medication for opioid use disorder, and remove some of the barriers that they perceived in being able to do that. So this work is happening. We also installed our naloxone vending machine at our Girard Street building a couple of weeks ago. It doesn't have naloxone yet. It has COVID kits. That was the guise so we could get state funding, but we can add other things. So there will be naloxone in the coming weeks for that as well. And that's really exciting. It'll be free, open 24 hours, an opportunity. I've already seen people using the vending machine. And then the council voted to support an online resource hub. That's the RIC. We are going to be able to expand it with new funding in order to be able to include services and treatment options around fentanyl and opioids specifically. So that's exciting. The intervention, there's 11 strategies, and this again gets into that really supporting providers in the field and outside the field. We're actually meeting with the Swinomish folks today, this afternoon, to continue that effort for that mobile medication that Mayor Lund described as well. And And then we, let's see, there's a lot in this that's happening already too, which is exciting. We received grant funding. We just found out on Friday, so you're the first to know. We received grant funding to be able to co-locate a substance use disorder professional in the ED at Peace Health. So they will be able to have that next connection point for folks after they overdose and be able to help sort of case manage after an overdose in lieu of them leaving once they've stabilized. So that's really exciting. We'll be rolling that out soon with council approval. And then we also received, or we repurposed some substance abuse block grant funding in order to support youth in the criminal justice system who are in juvenile court, who are at risk of substance use disorder. And this was a need that they identified actually in the last budget cycle, and there wasn't funding to support it. And so we were able to do that with this substance abuse block grant funding. So that went through last Tuesday as well, the council. So that's exciting. The 23-hour crisis facility, Chief Hewitt sort of alluded to the fact that there just isn't, well, more than alluded. We all know there isn't a place for people to go after the ED and or post overdose out in the field. And so we're continuing to work toward that long-term 23-hour crisis facility, but we're also exploring and trying to think about an RFP that we could ask community providers to open something on a temporary basis as well. So, so really looking at that and what is that other space where people can take a moment, get resources, and figure out their next plan. So there's good work happening there. There's also big work like recovery housing, lead capacity. Our council is voting to accept a grant that we received from the state tomorrow in a special meeting for that. And of course, there's big things here, there's tangible things here and smaller things. And then I'm going to move on to treatment. I don't want to take too long, and I want to make sure Kayla can jump in as well. There's 5 strategies in treatment, and this is the really big, long-term, challenging, complicated, but super, super important in the continuum kind of work. So this is the therapeutic housing. This is the recovery housing. This is building out that therapeutic campus on Division Street where the Ann Deacon Center is and where the 23-hour facility will be. This is supporting Lummi with their secure withdrawal management facility, and then really working with behavioral health providers, both locally, but also the larger providers in other counties to make sure that we have supportive services available for people, both on an in-person or inpatient and outpatient basis. And then lastly, that aftercare recovery. Again, these are big items as well. This is, again, that housing, recovery housing, including tiny homes, supporting employment and social networks. This is something that the MAC group is interested in taking on, and we're really looking forward to partnership from people who are experts in that supportive employment field. And then additional linkages for people. So there's warm handoffs from institutions and post overdose. So a few realities that will not surprise you, but you know, we have opioid settlement dollars at the county, but it's not life-changing for the county. It's helpful and supplemental. There's an infusion early, but then it will look like somewhere between $300,000 and $400,000 a year, which again is not life-changing. It is helpful, but it won't support all of these or even a few of these priorities. This isn't the full scope of the county's reach. There's work outside of my department that needs to happen as well. And I know from my conversations with Sheriff Tanksley that there's a lot of interesting good work happening in the sheriff's office as well. And I know that there's work in our court system, and Maya's here as well. Just really, we're all trying to think about how we can impact from where we sit. And then some of the funding is needed for a lot of different priorities from our council. So making sure that we work with our council to help scope out and prioritize the various needs like shelter as well. All of these have a big ticket price tag, and just making sure that that we're able to meet sort of and set expectations for the scope and scale of each of these projects. So I'm going to stop there. And if there's any questions, I'm going to stop sharing my screen so I can see your faces. Okay. And Kayla, do you have anything you want to add?
No, I want to hear what folks' questions are, and then happy to fill in sort of as opportunities come up to talk about some stuff the exec's office is working on in coordination with the health department.
Thank you both for such a robust plan and presentation. Are there questions from the task force members today? Or comments? Chief Mertzig?
I would just love to know more about Lummi Nation's secure management facility. I haven't heard much about that.
I know, Kayla, do you want to answer that? I know that, or Executive Sidhu, I know you've been in conversations.
Yeah, I'm happy to sort of chime in with what I know. I know Councilmember Buchanan's also in St. Paul. I mean, our understanding is that the Lummi Nation is building a secure withdrawal management facility, which is one type of detox facility that is licensed in the state. It is a locked facility, and that they're seeking state and federal funding for that facility. The exec's office has provided letters of support for that state and federal funding. They've been largely successful. It sounds like they don't have an additional local ask at this time, but continuing to chat with them about what gap funding they might need, and sort of what their referral mechanisms and plans will be. Electeds on the call, I don't know if you have other information you'd like to share as well.
Executive Sidhu?
I just wanted to add that my first conversation on this topic with them is that why don't we become partner with them rather than creating another facility for the county. It's a lot cheaper and easier for both city and county to go and participate with them. I have not heard back their plans yet. It's too early for them also to have specific plans for that. Money just it was announced. So we are engaged in that process in that matter that we would like to partner with them. That will be much easier way to enhance the total capabilities in our county.
I imagine the task force would love to learn more as you continue on that conversation. And my understanding from providers is that having that type of facility as an option in our community would be really significant. So are there other questions? I saw Raylene, I think you had your hand up for a moment.
Thank you, Heather. I really appreciate all the work that Erica and Kayla have done on this. It's exciting to see that everybody's coming together to try to work on this problem. We just announced today that we now have a minor guardianship facilitator that is kind of separate from this, but it does tie in because guardianship petitions are filed when it and granted when a child is not safe in their home. And so as we're part of a task force to prevent people when children have to be removed, or there's adults that need to petition to make sure that they have legal rights to help these children, a lot of times they can't afford an attorney. So having this facilitator is also going to pair nicely with these programs because that person will be able to make sure these kids are in safe homes and hopefully don't become a victim of the system. So I think this is just awesome that we're all working towards that. So thank you.
Very helpful information to share, Raylene. Thank you. That's excellent. Kayla?
Yeah, thanks, Raylene, for that. I just wanted to chime in on a couple places where I feel like we will really benefit from this group's input and coordination with input from our MAC group as it relates to the operations plan.
One is as it relates to sort of which inpatient treatment facilities we build next. Right now, there's about, maybe enough money in the state budget that we're able to get one of these every couple of years designated for our community. And it's the way the funding's working right now. It's up to us as a community to decide what those facilities should be. And so as we hear sort of more needs for different populations, working with stakeholders to sort of prioritize that pipeline of facilities is something that we'd be really interested in working with the IPRTF on, along with the MAC group. So wanted to put that bug in everybody's ear. And then in a similar vein, so the executive's office will work on our legislative strategy as it relates to behavioral health items. We are looking to procure a new lobbyist who has specific expertise in behavioral health and relationships in Olympia. So close coordination as we did the last year to get stakeholder input, provider input into what those legislative priorities should be. Running those through the IPRTF will be really helpful as we move forward as well.
Kayla. We'll look forward to sharing input on those legislative priorities. And on those facility prioritization. Erica Lautenbach, would you be willing to share, just in case people don't know, what is an adverse childhood experience?
Yes, thank you, Heather Flaherty. An adverse childhood experience, there's 10 ways, and these are significant. These are significantly impactful to children. So it's physical, sexual abuse, neglect. It's a parent who's incarcerated, or a parent who has mental health concerns, a parent with substance use disorder, divorce is one of them. But really the focus is on these really significant and sustained experiences that children have primarily when they're little, between 0 and 5, and create toxic stress, which changes their brain chemistry as it's developing for their life. So it changes things like impulse control and critical thinking and the ability to have a longer time horizon. Those kinds of things are impacted by these experiences, which result in there's a lot of evidence to suggest that it results in a lot of really poor outcomes in kids' life. So as adults as well, and a lot of unnecessary suffering. Thanks, Heather.
Yeah, thank you for that. I saw Mayor Lund and then co-chair Peter Fraser.
I just wanted to let this group know, to follow up on what Kayla just said, that the county and the port and the city have been sharing a lobbyist for several years, and we are issuing our separate RFPs for lobbyists. So ultimately, the hope is that will yield the best outcomes for Whatcom County, and letting everyone be able to concentrate on their strengths and their needs, and do hopefully that'll be a more efficacious strategy. And I would just say, with the county, the city remains very committed to where we need to be working together and be aligned in our legislative asks, that we continue, even though we'll have potentially separate representation, that we'll be working collaboratively. So, and very much committed to that.
Exciting. Thank you. Peter?
I just wanted to note on adverse childhood experiences that everyone can easily take a online test to see their own ACE scores, and it's a very interesting and helpful frame. I'm sure most people on this call have done it, but if you haven't, it's instructive.
And can I just add, I think sometimes it's really emotional when people take it and see that they've had ACEs, and just want to reinforce that, like, ACEs aren't a 100% predictor of poor outcomes. There are things that build resilience and things that change that trajectory. You can see that kids with really high ACEs, 1 in 30 use IV drugs, but 29 out of 30 do not. So it's not a sentence to suffering, but it is an indicator.
Thank you, Erica.
Peter, it looks like the questions may be complete on this topic. Would you like to introduce the next one?
Sure. All right. Next up, we have Kayla Schott-Bressler talking about the Justice Project financing agreement. Kayla, would you like to take it away?
Yes, I'm just working on getting my slides up. 1 second, and then I will share my screen. Okay. Still haven't quite figured this out, so. Can you all see this?
Yes, we can.
Okay, I'm gonna leave it in this format, though not pretty, because the alternative was not ideal either. Okay, so many of you have heard different versions of this presentation, but basically there was a request to sort of outline how the interlocal agreement with the Whatcom County cities and the county aligns with Ordinance 2023-039, which was the ordinance that put the Justice Project sales tax on the ballot. So I'm going to go over an abbreviated presentation that I've done for the county council, as well as some of the city councils that talks about this. I'll go through it and then happy to answer any questions that folks have. So I'll start by talking broadly about some first year updates. The policy framework for the interlocal agreement, the financial framework, what the oversight mechanisms are, both through the IPRTF, the JPOP, and the Finance Advisory Board, and then some timelines on our biggest ticket first couple year items. So you all should have received a written report from our office on our first year progress on the Justice Project implementation plan. That report focuses largely on the non-jail components of the Justice Project. Rather than going through everything line by line, I will leave some time here for some questions. And then as you all read through that report, please don't hesitate to reach out to me via email, via phone, with any questions on what you read. I'm really proud of our progress, and I just want to acknowledge Erica and her staff, because most of that progress is due to that team's work on the behavioral health side of things. So the policy framework, can you all still see this PowerPoint? Is it working?
Yes, we can.
Okay.
Yes.
So the ordinance has some big picture commitments. Many of you know this already. So commitment number 1, invest significantly in incarceration prevention programs starting now using local, state, and federal funds. This is something that we are really proud to report success with to date. So we received significant funding for the 23-hour crisis relief center. That project is very active. I'll share more about that in a minute. And then continuing to seek a lot of grant revenues from the state and the federal government to invest in diversion and behavioral health programs now. For the next 4 to 6 years, we're going to dedicate revenue from the new sales tax to build a jail that's adequately sized and that fulfills our commitments to the cities. And then after 4 to 6 years, dedicate 50% or more than 50% of sales tax revenues to expanding incarceration prevention programs and services. As I said, these commitments are all clearly spelled out in Ordinance 2023-039. So speaking first about the adequately sized jail commitment. So the ordinance language says that we will size the jail facility based on a fair analysis of jail use, bookings, and population growth, taking into consideration strategic investments to avoid unnecessary incarceration. And that any future expansion will be based on a mechanism for additional bed capacity if we reach 85% of operational capacity. But there's a very clear public process that's built into the ordinance that allows for community and county council review on any proposed expansion. And then, of course, there's some language in the ordinance that refers to protocols if there's any need to overflow into other county or regional jail facilities. On the long-term investment in incarceration prevention, as we all know, the 50-50 commitment here, 50% of revenue over the long term, for plans prioritized in the Justice Project implementation plan that are not the jail. So incarceration reduction programs, reentry services, diversion, behavioral health and SUD treatment. A lot of those services that Erica has outlined in the fentanyl operations plan are going to be long-term services that potentially could be funded by this Justice Project. Sales tax, supportive housing, reentry. You all are very familiar with the needs here. So the funding partnership with the cities. So by statute, the sales tax proceeds are split 60-40, with the county retaining 60%, 40% of revenue going to the cities. What that means is that City of Bellingham receives 27% of sales tax revenue. All the other cities combined receive 13%. The county receives 60%. We estimate the jail and behavioral health facility will cost about $150 million. And what we're doing is we're trying to get upfront money from the cities and the counties to buy down the cost of that debt, so that the long-term bond payment on the jail facility is no more than $6.3 million coming from the county's portion of the sales tax, which leaves 50% of the overall sales tax for incarceration prevention programs. As I said, meeting these commitments requires upfront funding partnership from the city, which is outlined in the interlocal agreement. So the cities back a year ago sent a letter to the county council and executive, basically saying, hey, we're willing to fund virtually any new correctional facility, but one thing we need to ensure is capacity to meet our needs. And in exchange for that capacity, we're going to make this 4 to 6 year investment to drive down the bond to under $100 million. In exchange, the cities expect no booking restrictions and no capital fees associated with the per diem language. The final language of the interlocal agreement meets this commitment, but there are some slightly different language around booking restrictions. And so we can get into that as we move along with questions. But basically, the interlocal agreement in principle matches the ordinance language here. The other main component is that the interlocal agreement commits all county and City of Bellingham tax proceeds to implementation projects. So that's the jail plus all of the other 14 projects in the Justice Plan. The small cities can use their proceeds on any eligible expense under the public safety tax, which includes sort of law enforcement and other criminal justice needs. Future implementation plans must be developed with City of Bellingham input through the IPRTF and the Finance Advisory Board. So there's both room for stakeholder and community input, as well as City of Bellingham concurrence through their city council on future implementation plans, given the fact that all city tax proceeds must be used consistent with the plan. And there's also some sort of additional representation from the city that's designated on the Finance Advisory Board to account for their significant commitment to using this revenue consistent with the Justice Project implementation plan. So I'm going to go through a few charts that talks about what this funding partnership looks like. So in 2025, so that's year one, the county would contribute 100% of its sales tax revenue to jail capital. That's about $8.4 million projected. The cities would contribute 75% to jail capital and 25% to implementation plan projects. So Mayor Lund just talked a little bit about what their vision is for that 25%, which includes continuation of many of the diversion programs they have discussed. The small cities would also keep 25%, which is collectively about $450,000 a year. So you can see the biggest part of the pie here in year one is this dark blue, which is jail capital, which is about 60%. Fast forward to year 7, that changes a lot. So jail capital becomes a much smaller portion of the pie, with the county contributing $6.3 million or 60% of its revenue towards debt service. that would give the county 40% of its revenue to commit towards implementation plan projects, with the city of Bellingham then having its entire $4.7 million to commit to implementation projects as well. So collectively, between the county's implementation plan projects and the cities, it's nearly $9 million projected towards incarceration prevention and behavioral health programs in year 7. And the small cities, again, would retain their share to spend on any public safety purpose. So some assumptions in all of this, right? Like you just saw sales tax projections. Sales tax is a volatile funding source. So we very much acknowledge that. So what you saw is based on a projected 4% sales tax growth year over year, a 4.5% interest rate on the county's facility bond, and $150 million cost of the facility. We expect through work with the Finance Advisory Board and work on the county side that in 2026, we will know the true capital cost of the jail facility. And then the interlocal agreement allows for us to sort of spread those impacts equitably and over time while maintaining the 50% commitment on the services side. Just another way to visualize this here, you can see the jail and behavioral health facility in this green color over time. First 6 years, a lot of money going there, and then flat beyond 2029 as the county makes its projected $6.3 million bond payment. The gray here is the city of Bellingham implementation plan contributions. The blue here is the county implementation plan contributions. And then this yellow is the allocation to the small cities over time that's not used on jail capital. So on the oversight side, the Finance Advisory Board will be the primary body overseeing the collection and use of the jail sales tax revenue. They will provide financial oversight, make recommendations on finance and operations, as well as some of the services that are going to that implementation plan category of revenue will go to over time. The Finance Advisory Board will report to the IPRTF, the County Council, and the Bellingham City Council on the financial performance of the fund and the associated programs, and working really closely with the county executive, the Bellingham mayor, and the IPRTF in the development of future implementation plans, as well as spending plans, sort of on a biennial basis for the justice tax. We, as I mentioned, sort of modified that representation slightly in the interlocal agreement. So there was originally in the ordinance a designation for a small, I believe, a municipal police chief that was changed to a Bellingham police chief. And then we really see also an opportunity for community input through the behavioral health system representative, the IPRTF co-chairs, and then the individual with lived experience who will be appointed to this board. The Finance Advisory Board will be convened by the executive's office this fall for the first time. It's an executive board of the county, and it will be subject to the Open Public Meetings Act. So anybody will be welcome to visit and tune into meetings at any time, as well as opportunities for public comment there. So I do want to just take 1 minute to talk about timelines of the Crisis Relief Center and jail project, because I know that's of utmost interest to everyone. So this is our Crisis Relief Center timeline. We've been engaged with a consultant on modeling the operational costs as well as the services side of things. We have essentially a scope of work drafted for what the services RFP will look like. And our plan is to concurrently this fall release the RFP for the service provider of the Crisis Relief Center, concurrent with the RFP for an architect on the Crisis Relief Center, and then that will be the team that really brings this new service to life. And it's really important to us that our service provider have input into our architectural design, because it's going to be a pretty complicated facility to run. But right now, best case scenario, it's mid-2026. that construction concludes and the facility is ready for occupancy. So that's why Erica and team are really excited about potentially getting a temporary facility, even if it's smaller. Because we all know waiting 2 years for a facility like this is a long time. On the jail side, so we are preparing some pre-permitting work, doing wetland studies, that sort of thing. Our facilities team has hired a full-time project manager. They will be hiring another individual likely this fall to handle sort of some of the design stakeholder input, the permitting process, and then working really closely with the executive's office and finance advisory board on assembling different project teams to tackle different components of jail construction. But best case scenario, concluding construction on the new jail facility in the first half of 2028. Right now, we're really focusing on the financing structure, in our team, in the treasurer's office, the finance office, and our office is working with our bond consultant about how to time and size the bond appropriately, given how we've structured the interlocal agreement with the cities. So you all will be hearing much more soon about what the framework is for input into jail design, jail construction. There will be sort of lots of tables that our office and the facilities department will be setting, and we're spending some time right now figuring out just what that framework looks like. So that is it. Always trying to keep our vision for the Justice Project at the forefront of our minds, and I am happy to answer any questions.
I don't know who is got their hand up there, but somebody from the sheriff's office. Oh, it's Tank. Please go ahead, Tank.
Hey, Kayla, great recap of that. Did you want to talk a little bit about the National Institute of Corrections that we have coming in July to assist with the planning of new institutions? So I think that's important to talk about.
Yeah. Do you want to share?
Sure. So the sheriff's office had reached out to the U.S. Department of Justice, their division of National Institute of Corrections, and essentially they have a program where they come to the community and just talk about the best practices of building a correctional institution and the supporting programs that go with that. So in July, they'll be here in Whatcom County with us for 3 days, and there's a cadre of stakeholders that will be there. So hopefully next month we'll report out to let everyone know how that trip went here.
All right, thank you. Arlene, I see your hand up. You're muted, I'm afraid.
Did you say where the jail is located?
I didn't say that. The expectation would be that the jail would be constructed on Levante Road in Ferndale.
What? Oh, Ferndale, yeah.
That's the expectation. Yeah.
Okay.
Are there any other questions? Kayla, you mentioned some changes around booking restrictions. Is that something you want to speak to?
I can. I'm trying to reference the interlocal agreement. I would just say there's no changes in intent to reduce booking restrictions, but the final language in the interlocal agreement allows to preserve the statutory authority of the sheriff to implement booking restrictions in the event that it becomes necessary. For instance, the sheriff may have a very legitimate health and safety reason to implement booking restrictions at a certain time, and then there's a protocol around notification of all of the related parties. Sheriff, I don't know if you want to say anything more about that.
Absolutely. So essentially what it does is it increases the level of communication from the sheriffs to the other small cities and other stakeholders. So versus just arbitrarily changing the booking restrictions, this language has some mechanisms in it whereby the sheriff would communicate not only to those small cities, but also to the financial board.
And if folks are curious, it's in section 4.2b of the interlocal agreement, the language.
All right. Thank you so much. Any other questions? Okay, I'll turn it over to Heather for the next item.
Thank you, Peter. We had a discussion with Spokane County officials on the agenda. I don't think anyone from Spokane is here this morning. I'll give just a pause just in case. Jed, do you see anyone that you know?
No, I think they decided last minute that they were not going to join this meeting. So my apologies for not getting that off the agenda.
That's okay. I would love to just acknowledge that they are here and they have come to learn about the Whatcom story of 2 failed jail measures, years of collaboration, and then a successful measure for public safety last year passing. So there's a whole delegation of Spokane officials. They'll be around the community. If you meet them, please offer all of our Whatcom hospitality and you're invited to answer any questions from your perspective on the story of Whatcom County's public safety and health sales use tax passing. And I just want to note that I think it's worth acknowledging that there is a story here and that this table of collaboration is unique. And I'm really grateful that all of you continue to come and be part of that because it actually makes really good things in our community happen. So exciting to have them here. I'd love to invite any other business from task force members. If there's anything anyone would like to share, please raise your hand. General updates, questions for future agendas, things you loved or hated about the meeting today. I'll add that the All Hands Whatcom Summit is Tuesday and Wednesday this week. If you can come, please do come. There's about 350 people registered. It's going to be a really robust community learning and conversation. And you can register on the Chuckanut Health Foundation website. We'll be offering lunch, so that's connected to your registration if you can join. Dr. Safford?
Yes, I just want to take a moment to thank our presenters today. I think the overall information received was incredibly helpful for those of us who are slightly out of the internal loop on what's happening. And I really appreciate the clarity and the detail with which both the city of Bellingham and the county has presented it. So thank you. I think it was an excellent use of our time.
Thank you for saying that. I told Erica I'm still getting my sea legs. I should have robustly thanked Erica and Mary Lund and Kayla for joining us today. Thank you. Mayor Cortice.
Were we going to go back to the annual report? Do we have a
Good
quorum?
question.
And I guess if we aren't, I'd still like to hear Peter's changes so that they can maybe be incorporated so we can have it all done the next time.
Jill, where are we with our quorum?
We do have a quorum. I have to apologize. Oh, there we go. I had a wild beeping on my computer that I couldn't stop. Yes, we do have a quorum.
Okay.
We can take care of that item now if you like.
Sure. Okay. Let's see. So on page 9, I would move that we replace paragraphs 2 and 3 on pages 9 and 10 and replace with the paragraph under project 3 from Kayla Schott-Bressler's memo dated June 18th, 2024, which is a fairly long paragraph. I'm not sure if you'd want me to read it, but basically it updates around our hiring. This is in the subject of data. It it updates with the latest news of hirings and also updates around the JAG grant that it was not only applied for but received. And so I thought that that would be an important change. Shall we just do these one at a time, Jill? And I can make a motion. We can vote.
Yes.
Or shall I go through them all?
Yeah,
Okay.
it's up to you and the task force.
Okay. All right. So I make that motion and wonder if there is a second.
I'll second.
All right. And any discussion on that motion? All in favor of the motion, say aye. Raise your hand.
Aye.
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 Any opposed?
I would ask anyone opposed to please virtually raise your hand so we can get a count.
Oh, very good. Okay, seeing none, that motion passes.
Excuse me.
The next one.
I
Oh.
do give an opportunity for folks to abstain if necessary as well.
Oh, sorry.
Please virtually raise
Any
your hand.
abstentions? Okay, I see none. Page 11, paragraph 1, change first sentence from is in the process of selecting a contracted facilitator to has selected a contractor to provide facilitation. Just updating the language there. Okay, so I'm making that motion that we make that change that I just stated.
Second.
Any discussion? All right,
I just want to, I do actually have a comment about this. We have
Oh,
not
yeah.
finalized this contract yet with the facilitator. We're still working on getting that through the council for their approval. So we are still in the process of selecting that.
Okay, well, I'm only interested in updates that are going to be helpful here. So I withdraw that that motion. Is there anything else needs to happen when I withdraw a motion? Or is it done?
No, that's good. You're done.
Okay, very good. Thank you. Page 12, update competency. Oh, no. Nope. I'm gonna leave that one be. Okay. Page 13, I move that the second paragraph under 24/7 Crisis Relief Center, we change the language from request of this nature instead of request if this nature. This is a typo, but I guess it needs a motion to change from request if this nature to request of this nature.
Jill here again. Yes, you're correct. That's a typo.
Okay, and so that does
need
not require a motion. Okay. All right, and page 16, paragraph 3, change from a number of processes will to a number of proposed changes would. This just clarifies some language. This is the last motion that I am making. Can I get a second on that?
Second.
And where is that at on
Got
that?
second. Paragraph 3. This is from the leadership statement. What I had been referring to has not, it's been proposed, it has not been accepted. This is the idea of having focus groups for frontline workers and people with lived experiences. So I'm just clarifying that we have not made the decision to move forward with those. May I get a second?
Second.
Second.
Okay, I have heard a second. Any discussion? No discussion. I am all in favor of this motion. raise your hand or say aye.
Aye.
Any opposed? Please raise your hand virtually. Bertie? Okay. I feel like I'm missing something. Oh, any abstentions? Seeing none, this motion passes. All right, that's it. Thank you. Any other changes before we vote to adopt the final report? Oh, Heather.
One thing that's just a typo on page 8, under the district court programs, there's an old number get new note. I'm assuming you're getting the new still, and we'll replace that in parentheses.
Which paragraph? That it does sound like a typo. Oh, there
Yeah,
it is. Yeah, I'll
first
just-
paragraph.
Thank you.
Yeah. And then not changing any content, but just a couple of notes that I would love to just put as bookmarks for potential future agenda items from this report. A report from the pretrial services unit would be wonderful to hear how things are going in the future and some upcoming meetings. And then also on the public defender's caseload and how that implementation is going. And just a curiosity if there's any of that analysis happening on the prosecutor side too. I think those would be great future task force discussion items. And otherwise, incredible work on pulling this report together. It always makes me really proud to be a part of this task force, Jill, and thanks for all of your collection of everything and putting it together for this report.
Thank you.
I'd like to second that. Jill did a great job with this report and made it all relatively easy for all of us, and it reads really well. I think it's going to be a very useful document. So thank you to Jill for that. All right. Would anyone like to make a motion? That is to, what would be the, we are wanting to vote to accept the 2024 annual report as written with the changes. Bertie, I see that you are making a motion. You'll need to turn on your sound. Uh-oh. We're still not hearing you, I'm afraid. Raylan, Bertie, can we hear you? Nope, we're still not hearing you.
Okay, now I just wanted to move that accept the amended annual report to the council.
And a second?
Second.
Was that Raylene? Very good. A second from Raylene. Any discussion? Hearing none, we'll have a vote. All in favor, please raise your hand or say aye. Aye.
Aye.
Any opposed? Please raise your virtual hand. Gonna wait for all those virtual hands to come down off the screen unless you're voting against. Maya? All right, very good. And are there any abstentions? Seeing none, the motion passes.
Thank you, everyone.
Thank you. Okay, and our last item is public comment. Jill, would you like to time the comments today? Keep them to 2 minutes, and if there are any rules for, oh, I see you put them up here. Do I need to read these, or is it okay to just leave them on the screen for a moment for everybody to read?
It's up to you. We can leave them on the screen if you like.
Okay. All right, very good. Do we have anyone who would like, from the public, who would like to make a statement? We have 2 minutes.
We do, give me 1 second, I'm pulling up my. Yes, if anyone would like to speak, please virtually raise your hands now. And it looks like I have 2 hands raised. I'm gonna call on Dr. Wu first, and just give me 1 second to go get my timer. While I okay, go ahead.
Dr. Wu, go ahead.
Hearing me. You can hear me okay?
Yes, we can. Thank you.
So this is very brief. I first of all want to thank, well, first of all, I'm Dr. Chia-Ying Wu. I'm retired family physician, locally intern at the Chuck Connett Health Foundation, also on the Behavioral Health Subcommittee. I want to thank the group for all the great work and the great reports today. It's really very helpful and hopeful. I wanted to say that for me, the sense of, or the process of people avoiding incarceration, recovering from incarceration, re-entering into the community, I really think of as a process of recovery and healing. And in my experience, it's almost like a disease process. And for this disease, I think of love, compassion, belonging, and having the sense that to our community, no individual is ever disposable, are really important features of the safety that allows people to recover and take the risks that are involved in recovery. And I know that those kinds of concepts are difficult to put into public policy, but I think the more that we can espouse that, the more we can move forward the cultural change that's needed to have a really profound long-term recovery. Also, I think that, you know, when any member of the community is disposable, none of us are really safe, because each of us is only one mistake away from being in that same position. And a lot of our, I think, current distress in society is because of that sense that none of us is ever really safe the way our society is currently constructed. So I think it would actually help all of us. Thank you.
Thank you for your comment. Do we have another commenter, Jill?
Yes, we do. We have Cherika or Sharika Ashman. Please go ahead and speak.
Good.
Yeah, my name is Sharika. Can you hear me?
Yes, we can, Sharika. Please go ahead.
Hi, I'm Sharika Ashman. I am a licensed independent clinical social worker, and I am actively experiencing a wide-scale hate crime that I've been illuminating since January of this year. I know many of you have received emails from me with pertinent information, as well as my podcast. So I'm here because I applied for 9 positions throughout the Whatcom County site. I feel I am way overqualified to sit on this board. I would start with, when you're reading a land acknowledgement, that you ask in the room if there's actually somebody who's native, who's present, who can do that. The way in which you read it is really offensive. I'll start there, but maybe put it on the docket for the next one. I have way too much to say in 2 minutes, but at this point, I have not been allowed to file a police report. I have found another victim as of 2 days ago. And it's talking about all of this. My ACEs score is an 8. You know what keeps me sick? Sick systems. So all of this right here is not representative of the community that you are saying that you want to help. You need to hear from us. I'm somebody that has pulled myself up by the bootstraps 1 million times. I'm done. This time, I need your help. You need to listen to me. I need to be able to file a police report. I have a trial coming up. I'm getting ready to be evicted from my home. I fucking service EMTs, firefighters, nurses, doctors. I think I have something important to offer here. Okay. So I'd like to know the process of which I'm going to be accepted onto the board as I meet all of the qualifications. I'm not asking, I'm telling you, you need me there. I'm calling the heat on all these people and I won't stop. Okay? I'm done.
Thank you. Do we have any other speakers online who would like to address the task force? Please virtually raise your hand now. And it doesn't look like we have anyone in our conference room. Thank you.
Okay, and with that, we will close today's Incarceration Prevention and Reduction Task Force Law and Justice Council meeting for June 24th, 2024. Thank you all for attending. I appreciate the work that you're doing in our community. And we will see you next month. And Jill, I will stay on the line for our discussion.
Thank you. We're adjourned.
Thank you.